I would now invite Srimati Gauri Singh, Principal Secretary, Department of Health and Family Welfare, Government of Madhya Pradesh, to kindly come and give her views on smart cities from smart healthcare perspective.
No. Mr. Pandey and participants in the room, ladies and gentlemen. At the outset, let me thank the organizers and the Government of Goa for having invited me here to share my views. What is very interesting is that, at least in the state of Madhya Pradesh, when the whole planning for smart cities was being put in place, then even though health is going to be a very major component in the way health sector is going to get redefined by these smart cities, but the discussion actually didn't happen. So it was the way this whole project got conceptualized, and I'm sure it's the same with other states as well, that it was basically something in urban planning. And now, as the concept is getting evolved and smart cities are becoming a reality and there is funding that is being available for them, now there are many other components that are being thought through. So in that context, I think it's a very timely kind of a knowledge exchange forum, which helps the key actors in the smart cities also look at the various other aspects that will impact not only the planning, but will also guide how a smart city gets built eventually, because it's not just brick and mortar, but many other services would need to be incorporated in the planning aspect. So let's look at how the demography of India is changing, and also let's look at who do we think will really be the citizenry which will be congregating around these smart cities. In all probability, it will be young professionals with 1 or 2 kids. There will be professionals in their 40s and 50s, but also a large number of retired people who will be staying in these smart cities, which also means that the kind of disease profile that we are normally used to is also going to be, it will have to be relooked. A large number of lifestyle diseases, which we club together and call as non-communicable diseases, are going to play a very important role. And these include things like, cardiac-related diseases, diabetes, cancer, and other things, which basically means that the entire focus of our healthcare system, which has largely been on maternal and child health till now because of the kind of demography we have had, will have to also start looking at these non-communicable diseases, which have a very different way of getting managed. These are chronic diseases and have to be managed very differently. So it's the entire chronicity of management that will have to be looked at. What is the current health scenario? Current health scenario, as most of you would know, India has a huge shortage of doctors. It is not so evident in urban areas, but definitely when you step out into the rural areas, this is something which is very evident. And these smart cities will act as magnets and actually attract many more people into these urban agglomerates, which means that there will be a need to plan for not only the number of people that you started with, but how gradually the cities will be attracting many more people into its domain. Right now, what you would see in most of these urban places, and I'm talking from the public health perspective, is 3-4 large hospitals. There will be some civil dispensaries, and they are of course complemented by the private sector, but that's pretty much what you have. And if you look at the way the public health system is geared, mostly the emphasis is on maternal and child health, which also points out to the kind of figures that we have for Indo patients in a state like Madhya Pradesh, and I'm sure it's many other states in the north as well. Around 70% of the Indo patients are maternal or children. So, which also brings me to the point that while in the rural health setting, there has been a very active outreach to the families, but in the urban setting, there is actually no system of actively reaching out to families. It is expected that the family or the person who's seeking any or has any issues relating to health will actually come to a hospital rather than some kind of a outreach by a health service provider that often happens in a rural setting. So there is a need to rethink about the traditional way that currently the health services are being provided in an urban center, because I think that if you have just more of what it is right now, then that's definitely not a smart way of delivering health services in a smart city. So in terms of what it implies for the health sector, I think clearly there is a need to rethink the basic structure of health provisioning. It's not about tinkering at the periphery. It involves a rethink, and I'll talk about what I mean by a rethink. It's also a need to reskill. So currently there are, for example, paramedics who are trained to provide skills in areas, but they have to work together as a team. Now the point that we will now need to look at is, do we need to reskill them to work as standalone units which are connected remotely through technology to other actors, and that kind of a reskilling needs to be thought about. And also, I think there is a need in a smart city to think about re-engineering the infrastructure so that it is in sync with whatever smart cities are going to look like, and it's not just some kind of retrofitting that normally happens. So, articulating more on what I mean by rethinking the basic structure, it's looking at health facilities not merely as curative centers, but as centers which have to also propagate wellness. Because traditionally our focus in the health sector has been much more on the curative side, not so much on the preventive and on the wellness aspect. So while the kind of demographics we have, we still would need obviously a large emphasis on maternal and child health, but alongside large departments which would cater to the people for lifestyle kind of diseases would also have to be created. So which means that a large part of the hospital will also have to be dedicated to prevention and well-being. And what do I mean by well-being? So the counseling for stress-related issues, for example, and that's a big deal now. Counseling on diet and lifestyle. Integrating our traditional medicine like Ayurveda, Siddha, homeopathy into the treatments. How do we also be looking at mental health related issues? Physiotherapy for the elderly and also geriatric care. These are all issues that currently the health system is not looking at very actively in the traditional mold of things. But when you're looking at a smart city and we're looking at the profile that will happen, we need to be looking at all of this. So we also need to think about whether we can have family-based need assessment and link them to a nurse practitioner and counselors. So nurse practitioners is a concept that is now slowly coming into the health sector very actively, because all of us, for everything that we, small illnesses and all, we don't need to necessarily rush to a doctor. There are many things that a trained nurse practitioner should be able to solve and should be able to give medicines for. So a kind of a screening or a filtering, as you may call it, would also reduce the load on our hospitals. It also means that we'll have to look at how our neighborhood clinics, there is, of course, in Delhi, they've started calling them mohalla clinics, but I think they need to be structured very differently to provide the kind of health services which would have both the preventive and the curative aspect. So that's something which I think needs to be looked at while we design and rethink our traditional system of providing health. On the reskilling, there's now a greater need for also providing counseling services. So family counselors is something quite alien to the Indian context of how we provide health services, but it's becoming much more important. We currently don't have courses other than the Master in Social Welfare, which can be as vague as you want it to be. So there needs to be actually, thinking through how do we get the right kind of curriculum which will enable the young, youngsters to be able to come into these courses and work as family counselors and multitask through, a number of related issues that they can give counseling on. Nurse practitioners also, which although there is now, the Nursing Council of India is looking at how, how they can start a course. But this is actually an opportunity for the private sector also to think through how a course which will allow existing nurses to upgrade their skills and be in a position to prescribe certain medicines so that there is a filtering that can happen at their level and the hospitals don't get overcrowded. Doctors will obviously also need to be skilled because, as we heard with the earlier presentations, you cannot have smart systems without the people who are going to be a part of it not getting skilled to use it. So if we are going to be talking about e-health records, then doctors need to be skilled as well. Then let me also speak about how we need to re-engineer our infrastructure. And I think Mr. Pandey will talk about it more, but let me just briefly touch on it. Currently, whenever we introduce any technical innovations or interventions into our system, we tend to do it very organically, and especially in the building space. So if there's something new that needs to be added, we add a new room, or we do it as if you're just making more space. But we never think really in terms of how the flow gets impacted when a technology intervention gets made. And those kind of things have to be thought through by hospital planners and architects, because if we are going to get into smart buildings and energy efficient buildings even for hospitals, which are also resource efficient, then experts like the hospital planners have to think through the way the flow of people will happen, how technology induced interventions will actually have an impact on how a building should look like, and those have to be also integrated. Telemedicine is something that is here to stay and it's here to grow. And telemedicine is something that will happen at multiple levels. So a nurse practitioner with telemedicine, consulting with a doctor who might be sitting remotely, or a doctor sitting at a secondary level hospital consulting with a super specialty sitting remotely. So, those are aspects that definitely need to be planned when we are moving forward with this whole idea. And then we also have smart diagnostics, which really means that, for example, in Madhya Pradesh, we don't have enough radiologists in the public health system. So we're looking at tele-sonography, tele-radiology, so that you can actually get people from remote corners of the state to be able to access specialist service, and a specialist reading their reports and giving their advice on it. E-health records is something that a large number of states have started working on. And again, this is not something that can be done organically, that we suddenly think on one day that let's do the same that we are doing manually or through some kind of a software, and let's try and put the same thing into a e-health record. The whole structure will have to be thought through. Where are the primary data entry that's going to happen, and how it's going to go up to decision-making levels that require the kind of inputs. And I think enough has been said on big data analytics, and that applies for e-health records also. Privacy, of course, is going to be a major issue, because your health record is definitely something that requires a lot of privacy, and if it has to be used by anyone, then it has to have the consent of the person that the record is for. But one will also have to think about the kind of layering that this data can have, so that it becomes available to IT professionals to develop the kind of apps that citizens might find it useful to monitor their own health, or get reminders about what kind of tests they need, or doctor advice that they need from time to time. So in conclusion, I'd just like to say that it's time to think of health also in the context of smart cities, and it's not that it will evolve. It needs to be thought through as an important component of the smart city, and a whole holistic thinking has to be done. And I would in fact go as far as to suggest that this needs to be thought through not by every smart city that is evolving, but maybe a kind of a national task force that has hospital planners, has health professionals, has IT professionals, and also administrators all coming through to think about which particular aspects should be integrated into the whole concept and the planning of smart cities, so that when we have something to show in 2019, then it's something that's also smart for the health sector.